Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the classification of general anesthetics. The general anesthetics may be classified into inhaled and intravenous anesthetics. In the class of inhaled general anesthetics, gas, nitrous oxide, volatile liquid, halothane. And in case of intravenous classification, there are the 5 type of classification. First is the barbiturate, that is the thiopental, and the dissociatives are the ketamine, miscellaneous are the etomidate, propofol, opioids, and the benzodiazepines. First is the halothane, and also we known as the fluothane. It is a volatile liquid with the sweet odor, non-irritant and non-inflammable. Solubility in blood is moderate. Induction is reasonably the quick and the pleasant. It is not a good analgesic or the muscle relaxant, but it potentiates competitive neuromuscular blockers. Halothane causes the direct depression of myocardial contractility by reducing intracellular calcium concentration. Moreover, the sympathetic activity fails to increase the reflex. Next is the pharmacology action. Halothane causes the general anesthesia due to its action on the multiple ion channel, which ultimately depresses the nerve conduction, breathing, cardiac contractility. Its immobilizing effects have been attributed to its binding to potassium channels in cholinergic neurons. Halothane's effects are also likely due to binding to NMDA and the calcium channels, causing the hyperpolarization. Next is the dose. 2 to 4% and for maintenance of the 0.5 to 1% is delivered by the use of a special vaporizer. Next is the indication. Halothane is a frequently used anesthetic in developing countries because it is relatively cheap and non-irritant, non-inflammable, pleasant with the relatively rapid action. It is particularly suitable for use in children both for induction as well as maintenance. In adult, it is mainly used as a maintenance anesthetic after IV induction. So, in today's class, I discuss about the various classification of general anesthetics like inhaled, intravenous and halothane in detail, that is their pharmacological action, dose, indication, and next is the benzodiazepines. Thank you for watching.